News. We begin with breaking news.
And that breaking news, Governor Michelle Lujan Grisham is about to give an update on our state's efforts to combat the virus. We go live now to Santa Fe.
I want to tell you a little bit about this mask. This is made by a teacher at West Las Vegas. Her name is Candace Thomas. And Candace, it's got a place for a filter. It's an incredibly thoughtful and meaningful product, and I'm very grateful. And for all the people, I'm going to try to wear one each time we come. We donate as many as we can, and it also means it means a lot to me that you're demonstrating that you're wearing these masks, that you're an effective role model in your community, and that you're providing this protective gear to me as the governor. So thank you very much. So let's get started today. I want to go right to the first slide, please, which is our case update. You can see that we now have 4,138 total cases. We have 107 new cases today. We have 178 hospitalizations and 48 on ventilators. And I do this for individuals who might be joining us for the very first briefing for the very first time. Early in the briefings, we laid a foundation about what our hospital resources look like. New Mexico has some of the most scarce healthcare resources. That means hospital beds, hospital equipment, hospital providers, and healthcare providers per capita in the nation. We have about half as much per capita as most states in the country. So we really have to work hard to protect our healthcare workers and to really watch how many people are in the hospital, how many are on ventilators, and making sure that we slow the spread so that we can manage this number to make sure that we don't overwhelm our healthcare system. Unfortunately, we have 162 individuals who have died because of COVID-19. Today, we're announcing 6 new deaths. And again, I don't know who the individuals are because that would be a violation of privacy. This is the only time that I can express our deep sorrows and condolences to the families who are devastated by this pandemic and by COVID-19. Your entire state mourns with you, and it is painful to talk about these deaths each and every time. And as of today, we have provided 83,251 tests. We can do more tests, we can do better, and you're going to hear from, of course, Secretary Kunkel, who leads that effort, making sure that we're doing our tests. I believe I have a couple more slides. Let's run through those, please. Okay. So we have this on a slide because many of you take screenshots, thank you, and promote them. That is exactly what we need you to do. All right, we have to, no matter what is happening, infection rates, and they should, we're working towards that, mitigate, should decline, that we want to look at economic recovery aspects that mitigate infection spread, protect as many people as possible, save lives, focus on supporting our first responders and healthcare workers, but none of it, no amount of effort in that regard will work without a vaccine unless the social distancing, which is our social contract to one another and the state, unless we maintain that. And so what does it mean? It is the only way that you can prevent spread. It means I cannot be near another human being. We follow the CDC guidelines, so you want to stay at least 6 feet away. Social distancing does mean that if you're going to go out at all, if you absolutely have to, right? We realize that essential services have to be procured. People have to leave their homes. But then when you leave your home, you still have to maintain that 6-foot distance from another human being. And it means wearing a mask. You're going to see in our slides that a lot of that movement is increasing by New Mexicans, and this is problematic because in 14 days, we have no doubt it will indicate an increase in transmission and an increase in cases. It's exactly the opposite thing we need to be doing. And when I'm out, and I'm not out very often, and when I am, it doesn't mean, however, that we're not working, but when I'm out, I have to say that I'm seeing far too many New Mexicans who are not socially distancing, who are not wearing masks, and who are not managing or maintaining their social contract. You are protecting others from you, and the only way that you can do that is to stay away from individuals and to wear a mask. Social distancing does not mean going about your regular life with your friends and family with this has a little bit of space or no space between you. In a world where we don't have a vaccine, it is simply not safe. So please, I hope I gave you enough time to take that photo, screenshot of that slide and get it out to the general public. We have to continue social distancing. Next slide, please. All right. Every single illness, every single transmission of COVID-19 is an incredible risk. Every single death is a tragedy. Saying, and this is now appearing, it's coming to me directly as the governor by New Mexicans. It is certainly being promoted in the country that there are going to be deaths anyway. So go about our business. That is entirely unacceptable. It's unacceptable in New Mexico, it's unacceptable in the country, and it's unacceptable in the world. We have the ability to reduce risk, which means reduce or preventing altogether deaths. And the only way that we do that is by deciding that that is absolutely unacceptable. And so I need your help here. Stay the course. Stay in your bubble. Don't give in, don't give up, stay hopeful. Think about the power you have, the power that each of us have to make a difference in our own communities and state, and the lives that you will save. And I know I do this a ton, and I'm going to do it again. That life you save actually can be your own. It can be someone's child, and it can be someone like me, someone's mother or father or neighbor. And we really need to keep doing that. Again, social distancing is the only way to prevent more illness and death in our state. And then remember, it is up to you. Until there's a vaccine, all the personal decisions that you make will determine, here's the key part, the actions you take every single day determine our course of action to safely and prudently reopen. And we're getting good advice from our Recovery Council and all of our subgroups that are based on advocates, experts, small business owners, industry experts, but no amount of recommendations they make will work, short-term or long-term, unless you follow and continue social distancing. Next slide, please. All right. So face coverings for businesses. This is a new announcement. We've been strongly suggesting that businesses should follow the best practices and the guidelines that we give every single New Mexican. But effective May 6th, tomorrow, employees at restaurants and essential businesses operating as a retail space with a footprint greater than 50,000 square feet will be required to wear face coverings. They can be do-it-yourself if you're a business that has access to other face coverings and masks, like surgical masks. That's fine. We just want to make sure that you're using something and requiring every single one of your employees to have these face coverings because they're protecting the consumers that come into contact with your business. Effective May 11th, every business that is identified as an essential business in the current public health order, that order is in effect until May 15th, operating as a retail space shall require employees to wear face coverings, cloth masks, surgical or procedural masks. We know unequivocally that this will help us protect those consumers in solidarity and making sure you're doing your part. I highly recommend that you wear face coverings for all of your essential travel to a business. Next slide, please. All right, so why are we doing all of that? Well, the number one reason, even though this slide says phase one, The number one reason is to protect each other, to slow the transmission, to mitigate the effects of this virus. But if we're aiming for a phase one, remember from last week we talked about our guidelines and our efforts to relax restrictions, to methodically and safely, prudently and productively to open up New Mexico for business. Well then, we have to show that we have this infection managed to the highest degree possible. So in aiming for phase one, which is mid-May, we make that decision based on the data. The data will tell us whether or not, because we're testing every day, we're seeing who's in the hospital every day, we're tracking every single tragedy every single day, then we're going to know unequivocally whether enough people are socially distancing and are following these CDC best practice guidelines. So before we can move forward, I have to see unequivocally by the data that the spread of the virus, in fact, is continuing to be mitigated. So, your decision, every single New Mexican, every single business that works diligently to meet both the requirements, and if you're not included in that May 6th, May 11th requirement, lead by example. These personal decisions unequivocally determine whether it will be safe for us to move forward in mid-May. Next slide, please. Okay, I have some nice and good and positive, productive and fair, long time in coming. So we finally are getting access to our federal stimulus money. And I wanted to announce again that we are going to be providing early childhood. This is really early childhood care, child care center worker hazard pay. And remember early on, we required that a number of employees and employers maintain business practices. Well, having access to child care for healthcare workers and first responders and other workers in the essential workforce workspace have to have access to child care. And so all of these child care workers and all of these child care providers statewide since March have been staying the course and have been serving safely and productively in a compassionate and lovingly way all of these children, all of these families. So our brand new department, our Early Childhood Education and Care Department, that's what the ECECD stands for, they're going to use a portion of their federal CARES, that's the number of the act that was signed into law that provides now stimulus funding to states. They're going to offer incentive pay to early childhood professionals working in centers that remain open during this pandemic. So I want to point you to is $700 a month in addition to their current wages and salaries. It's an incentive for full-time workers and $350 a month wage for part-time workers, so exactly half of that $700 a month incentive. We're also going to provide $12 million in grants for licensed child care providers who have been unequivocally harmed by this health emergency. Now, I do want to say, and frankly, it needs to be said more often, some of the lowest paid professionals in any careers in the state are in early childhood and in child care work. These incentives or hazard pay efforts are really important, and I wish it was more. And every New Mexican needs to think of a way that you can thank these incredible workers and the sacrifices their entire families are making to make sure that critical services continue, and quite frankly, to make sure that our healthcare workers have the support that they need to support and protect and provide the necessary life-saving healthcare services that you need. So a huge shout out to all those child care centers and all those child care workers. We're grateful, and I'm very pleased to announce this, people should expect this to happen as quickly as we can get this money out the door. Next slide, please. All right, I am going to do this. I don't know that this slide is actually mine, so I'm going to leave it up there, and we're going to go. I'm going to call on General Nava, and he's taking off his mask. Go ahead and do that, General. But I just want to also thank the men and women who serve this country without delay, never asking questions, and being very clear that they have a responsibility to make sure that all of the efforts we undertake to keep people safe, fed, and access to water is occurring. They're also ensuring that we are getting our test samples couriered to laboratories. They're cleaning nursing homes. He's going to talk to you specifically about much of this, but it's a great place for me to thank the men and women, General, and their families, and to also thank you personally for your leadership and your work. General.
Thank you very much, Governor. Before I start, I would also like to extend that thank you to the families and employers of the over 600 New Mexico National Guardsmen and women that are here. We can't do what we do without our families and without our employers, and they've been incredibly supportive of us. And so I'd like to thank them as well. We have over 600 New Mexico National Guards men and women who are on duty and who are doing great work throughout the state. They've driven over 140,000 miles, delivering over 4.3 million pieces of personal protective equipment throughout the state of New Mexico. They have also delivered countless pounds of food and bottled water, tanked water, and individual meals throughout the state of New Mexico. New Mexico National Guard is also very involved with the Department of Health in doing medical screening, helping with the testing sites, assisting with long-term care facilities. They're very, very active in doing everything that we can possibly to help our fellow New Mexicans. I think we all should be very, very proud of what the New Mexico National Guard is doing, and thank you, Governor, for the opportunities that you've given us to do this and help our fellow New Mexicans. I believe we have some pictures. They may be coming there. So we have some photographs. Here's some of your New Mexico National Guardsmen and women delivering personal protective equipment. I believe this was at Laguna. Again, we have distributed over 4 million pieces of personal protective equipment. We've delivered tanked water all over the state, and one of the things that we want to do is make sure that our fellow New Mexicans are safe. So what you see right here is one of your New Mexico National Guardsmen testing the water to make sure that it is appropriate for potable water consumption. And there's one of our National Guard folks helping out at a test site, giving the thumbs up again for the great work and collaboration that we're having with the Department of Health. Again, ma'am, thank you for the opportunity that you've given us to help our fellow New Mexicans, and we look forward to continuing to help as we all get through this together.
Got it. All right, we're going to go next to the Secretary of Health, and I know that we're moving the camera a little bit slowly, so that's complicated. Before you go to the Secretary of, right here. Well, I know. So thank you. Sorry about that. Those photos do not do justice to the amount of work that the National Guard is providing. They are quite literally nearly in every single community. When you hear from the Secretary of Health by the multiple efforts and sites and communities that we're in, and that it's not just delivering food in places that really need it, that don't have ready access to food and water like so many of our sovereign nations. These are also food deliveries to seniors and to children, making sure that since school's been closed, that not a single family who was expecting those meals for their children to be delivered and prepared at school, that's happening with the support of the National Guard. And any of our state police activities that require setup and related support, not police support, but just the rest of it, that's your National Guard men and women, and they also manage our Emergency Operations Command Center. So it's an incredibly comprehensive effort. I don't know how they do it all with just 600 men and women, and I want to make sure that New Mexicans know that, frankly, those photos are great, but they don't do justice to the amount of work that you're doing every single day, and they're on call and delivering much-needed services 24 hours a day, 7 days a week. And without them, there is no way we could manage this pandemic. So again, thank you to those men and women and the families and the employers. Okay, I'll try to do a better job so I give better cues. Now we can go to the Secretary of Health. That's my fault. Now to the Secretary of Health.
Thank you, Governor, and I would echo that about the National Guard. They are standing up test sites for us in high-risk areas. I'm deeply appreciative of that, of the many, many things they did. And there's also a National Guardsman on our testing team who has been an exceptional aid to us. And as the governor said, we have performed over 83,000 tests to date. We have the capacity to do 5,000, and I'll be talking a little bit more about this. But we need the efforts of both the state and our private and public partners to reach that capacity. As you know, we've been focusing on long-term care centers, on congregate sites, essential workers, grocery stores, childcare workers, but everyone can get tested. And if you are an individual and you want to be tested and you don't know how, you can call your local public health office and they will schedule a test for you. Or you can call our 1-855-600-3454 line and make a request that will be delivered back to the Department of Health. If you're a business or a municipality and you want to be tested, call the public health office and ask to be placed on our calendar. We do have a calendar of testing, so we plan ahead, but we will work you in, particularly based on the urgency of your need. As for our long-term care facilities to date, we have 71 total, as you know. We have 268 assisted living facilities, and I report on these always because they are such high-risk areas. We've had 64 of our 71 sites have done their surveillance testing that we have required, which is 15% of the staff and 15% of the population if you do not have any positives in your facility. 85 of the assisted livings have begun their surveillance, and the Department of Health continues to work with them to increase that capacity there. 7 of our long-term care facilities have more than 10 positive cases, and 23 have between 1 and 10. That was as of yesterday. There may be a change in today's numbers, and I will double-check that. We have a corrections initiative underway. By May 13th, we will test 100% of the guards and staff, 25% of the inmates, and we will make sure that every new inmate is tested on the way in and has a 14-day isolation. We will also be reviewing their isolation practices and plan to make sure they have an adequate isolation plan in place for any new inmate or anyone who tests positive. We are beginning a careful and deliberate testing of our home and community-based waiver population. We have 5,000 people who are on our waiver. And we're beginning with staff. 100% of staff are being tested now. We are working with Disability Rights New Mexico and Guardians when we approach testing our individuals. That is underway. And looking forward to the next week, we're developing initiatives or plans to test any recreational area, essential workers in the area of a park that might be open or where there may be increased activity in any recreational area, and also along the Texas border. And that's what we have today. Thank you.
All right, and then before we go to Dr. Scrace, okay, thank you. A couple of things I want to add about testing. So you might remember that New Mexico was one of several states identified by the federal government to be part of a pilot. The details of those pilots are very state specific. We have capacity based on the work of the Department of Health and other partners to test 7,500, and if we needed to go beyond that, I have no doubt that the Secretary of Health and that team could do that. The reason I say this, or goal, is to get to 5,000. We need individuals in the state to be aggressive and assertive. Tell us who you are and where you are. Let us get you tested. More businesses need to come to the forefront. We want to expand that. The more we know, and the better prepared we are to make the next set of decisions about how we productively, safely get back to what the new normal will look like as we live with COVID-19 until we get a vaccine. In saying that, I want New Mexicans to know that to get to the next goal, which is 7,500, We really need your full participation. And that's why minority communities, tribal communities, corrections, long-term care facilities, grocery stores, child care workers, our bases, any number of assets, our national labs. We want to be really clear that we are assertively and aggressively expanding testing and surveillance in the state of New Mexico. And I want to thank the Secretary of Health and that team for putting us in that position, but I really want New Mexicans to be very clear. If we all work at this together, we can quickly ramp up testing. The only caveat is that we are, with a high degree of confidence, assuming that the supplies for testing that were really choked before are not going to get choked in that supply chain again, and everything we need for that testing will be maintained with all of our partners. All right, Secretary Scrace.
Thank you very much, Governor. It's a pleasure to be back today and update you all on how we're doing as a state. There's some good news. There's a lot of caution today. And so I want to walk through the basic data and talk a little bit about the gating criteria, which we talked about last time, and then spend a little bit of time on the spread of the disease, which is not trending this week in the way we were hoping it would. So if I could have that first slide, please. We'll start there. For those of you who've seen these before, these should be familiar maps. On the left, you have a map of New Mexico with each county and name and the number of cases we've seen so far in that county. Last week, Bernalillo County was surpassed by McKinley, and San Juan is very close now as well. You can see those cases by county, and you can still see that it's darker in the upper left-hand corner of the map where most new cases are occurring. On the map on the right is just what percent of people in a given county have a COVID infection that's been confirmed by a lab test. You can see McKinley is actually the highest. In fact, the percent of people in McKinley County who have had a COVID infection is 12 times higher than in Bernalillo County. In San Juan County, it's 6 times higher. So we continue to see a high rate of cases there. The next slide, please, will show you, I showed this last week as well, it's updated for a week. It's 7 days looking back, so there's a 7-day lag on this. Looking at the average number of new cases, the red line is the number of new cases in northwestern New Mexico, San Juan, McKinley, Cibola. And green is all of the rest of New Mexico. Now, there are 2 things about this slide that I want to point out. Number one is it still seems like it's going up. We see a little bit of downturn in the northwest at the end of that red line. And as new case reports come in, we'll have more information next week. But it's possible that we are getting close to a peak, but by no means certain. The other thing that is actually disturbing is if you look closely in the green line, where we're seeing about 30 new cases a day, you'll see that's going up. And I'll talk a little bit more about why that is, but we are not actually seeing that downward trend. That green line should look like a mountain, and it should be symmetric. It should go up, and then it should come back down, and you see it's actually plateaued off there. And that is a problem for us in terms of containing the spread of the disease. We've been talking about doubling time. The next slide will show this, and that's the length of time it takes the number of cases to grow. We started out at 1.9. We're now at our high of 6.3. It's over the whole life of the infection here in New Mexico, the epidemic. And so actually lately we're getting closer to 1.5 to 2 weeks over the past couple weeks. But notice the words on the graph. At this point, for every active case we have, that will turn into 27 new cases in 30 days. And so again, this virus is very contagious. It spreads very rapidly, and the value of social distancing is just as important now, if not more important than it was in the beginning of the infection. So now we're going to go on to the gating criteria, and if this is your first time tuning in, let me just walk through what this means. So gating, it's like a gate, and what we're saying here in New Mexico is there are 4 ways we'll know that we're ready to proceed with opening things up a little bit more. And I mentioned last week, now there's probably 40 state plans out there, plus the federal plan, and all of them, with just a very few exceptions, have 4 things that everyone's looking at to determine whether it's okay to open. Now, some states already opened up, and they weren't very specific about their criteria or what they needed to meet in those cases. And I think there's evidence now coming out from other countries and other states even that they're seeing an uptick in cases, perhaps from opening too early. But the 4 things are, number 1, the spread of COVID, and I'm going to talk about that a fair amount. The second one is testing capacity, which I'll briefly mention, but I just want to underscore again the amazing job that Secretary Kunkel has done leading this team, and the rate of increase in testing per day is very impressive. We have a target of 5,000 tests a day. We're at 3,069 as of today, averaged over the past 14 days. So that is actually a significant improvement. The third criteria I'll talk about next week because I don't want to overload people this week. It's about contact tracing and isolation capacity and how we measure our ability to do those in a quick fashion. And lastly is the statewide healthcare system capacity, and we're going to focus on 2 things. One is ICU beds in our hub hospitals, because now 95% of ICU beds are in the hub hospitals, and that's where people are getting transferred. And I just want to give a shout out to Mike Richards and Clay Holderman and Troy Greer and Mike Ciccarelli, who are the key hospital leaders who have found a way to turn the 230 normal ICU beds that they have amongst them into an additional 384 more, which is just amazing. Now that involves converting regular rooms, but what we're saying is when 3/4 of that absolute maximum capacity gets filled, we need to save room and we wouldn't open further. So those are the 4 criteria. And just again, to remind everyone, every one of these is driven by social distancing, every single one of them. And I'll talk about that a little bit more as well. On the next slide, we'll talk about the spread rate. And, if you look at this graph, it goes back to late March. Actually, the very first spread rate we had was 2.5. It went up to 3, and then it's been coming down. Spread rate simply is the number of people that the average person with COVID infects. And so if you look at that, you think 1.15, wow, that's not too bad. But anytime that number is greater than 1, it means that the epidemic gets larger and larger and larger. The other thing is, even though the distance between that blue line at 1.24 today and the dotted line at 1.15, which is our target, even though those look really, really close, I want everyone to understand that carried out, if we just keep going exactly the way we are with just that much space for the next year, 3,976 additional fatalities are projected to occur. 3,976 against the 163 that we have today. So don't be deceived by, I like doing the graphs so they always go down to 0, but don't be deceived by that small space because there's a lot of risk for the New Mexico population in there. Now this is broken down by region. It's a little harder to read. Next slide, please. And I have the numbers on the next slide, but there's a couple things to notice. One is that there are a couple regions that are really skirting with that line. The Northwest region is the top line, but the rate of spread is coming down a little bit, and this is good reason to be optimistic. It's lower than it is last week, and even though that red and green graph that I showed you where the red was at its peak, this may be some evidence that we're going to start turning the corner in the Northwest. We have to keep doing everything we're doing, but the fact that it's coming down is encouraging. The fact that the other ones are kind of flat, though, is the problem that I mentioned earlier. And you can see here that go to the next slide, thanks. The same graph, but Metro region now is at 1.24, which is the same as the average for the state. The east side of the state is doing fairly well. Northeast and southeast, very close or right on the gating target. But remember, the gating target is for the entire state. We're not doing this by individual regions because people do drive from place to place. They cross county lines. And you can see still quite high in the Northwest at 1.31, but we actually saw an uptick this week in the Metro region, and I wanted to tell you a story about that in a minute. If you go to the next slide, this is the average number of miles that New Mexicans traveled by day since the beginning of the epidemic. If you're new to these presentations, the low troughs between each one are Saturday and Sunday. The very, very lowest point in the green line, 2/3 of the way across, was Easter Sunday. And what you will notice, and what I noticed, is we now have 3 additional weeks in a row marked by that red arrow where the amount of travel that New Mexicans are doing is going up. People are getting out. And that's okay if everybody is just going out for rides in their car and not interacting with other people. But when we interact with other people, that's when the virus spreads. And this weekend I was stuck up on my roof fixing my swamp cooler and realized I wasn't actually stuck. I was up on my roof, had the swamp cooler disassembled, needed a part, and realized I had to go to a store to get it. I didn't want to go to the store. I've been really good. I haven't come anywhere but press conferences in my house in quite some time. But I got my mask on. I got in my car. I brought the broken part that I needed to replace with me so I wouldn't forget. And it was good news. There was bad news and good news. The first bad news was I parked further away from the door of that store than I ever had in my whole life because the parking lot was so full. That worried me. I walked up, and the good news was they were metering. They were determining who could go in when, and they were counting people going in and counting people coming out to make sure there weren't too many people in the store. That reassured me. People even in line were, on the way out, were 6 feet apart. On the way in, there wasn't a line. They let me go right in. I had my mask on. But then when I got inside, none of the staff were wearing masks, and I was one of 5 people wearing a mask out of maybe 50 that I saw. So 90% of customers weren't using them. I got my part. I was really nervous. I came right home and told my family, we're going to have a problem in central New Mexico. People are too close. They're not wearing masks. We're going to see an uptick of cases. And then 2 days later, we got the modeling report today, and indeed, that is the case. Now, we do have an order that should help if every employer gets their employees masked. If all of us desire to protect other people, remember the mask is not to protect you, it's to protect the other people from you. Up to 44% of people in some studies transmitted COVID before they had any symptoms. So please work with us to protect others. Testing, I mentioned. The next slide, you can see our target of 5,000. We're just over 3,000. If you kind of squint at the line recently, it's really turned up, and we may well be able to meet our target by the middle of May, as the governor was referencing. A lot of great work doing there, and a lot of testing on special populations, vulnerable populations, which is very important. So just in summary, where are we? So for gating criteria, spread, not improving. We're actually perfectly level. So unless something changes with social distancing, we won't reach that target by May 15th. And remember, almost 4,000 additional deaths over a year's time if we don't change something. Testing, good. We're aiming for that target by May 15th. Contact tracing, we're automating those measures. I'll talk about those next week. And delivery system capacity, that's green, means good. So every single one of these criteria is influenced by what we do. If we stay at home, wash our hands, clean surfaces, cough into tissue, stay 6 feet away from people, and wear face coverings when we go out, we can bend this curve again downward to get to the point where we can open, because we have to learn how to live in a COVID positive world. We can't keep doing what we're doing for another year. So it's, as the governor said, it's all really up to us. Please, please protect yourself, protect others, wear a mask when out or a face covering, stay 6 feet away from people, and do all those other COVID safe practices you know to do at home. The last slide is just a support line for behavioral health and for healthcare workers. We show this every time, and feel free to call us if you need help. Thank you.
All right. So I'll close. I want to thank the team who's assembled here. I want to thank New Mexicans for tuning in. It is critical, again, that we feel like this is a statewide effort. And while we report in the different regions, we track to the zip code level what's occurring so that we can prepare for best case, worst case scenarios. That means preparing our first responders and healthcare workers. But it also shows us what strategies we can do to improve these outcomes. And I always feel a little bit like every single press conference, we're just sort of harping on the obvious. But let's do it again. We are not, by the data and by our personal experiences, and I'm sure your very own, seeing the kind of consistent work by New Mexicans to do everything that you can to protect the state and each other. And the standard really has to be this. You have to treat everything you do every day as if you have the virus. Not as if somebody else has it, although, let's talk about that, right? That you have it. And so what you're doing is making sure that you're protecting your family, your neighbors, your friends, your contacts from acquiring that virus. And while a do-it-yourself mask, like this incredible mask that was made for me, this won't 100% protect me from giving it, but it mitigates to such a high degree that the CDC and other experts, scientists, researchers, and doctors unequivocally identified that this is a practice that all of us can adhere to, and it makes a monumental difference in slowing the spread. And the other issue that you need to be actively engaged in is making sure that we're all communicating this and that we're very clear. So A, federal government did not have a testing strategy. B, that means that we didn't have the right supplies. C, that means that they had narrow testing protocols. So what should we do? We should really just test people who are sick. How sick? They should have one of 3 early criteria, right? Shortness of breath, sore throat, dry cough. Right? That has been greatly expanded to include such things as loss of taste and smell, nausea, headaches, and a variety of other now symptoms. But what do we know now about this virus? What we know is that the vast majority of individuals that we are testing who are now COVID-19 positive had none of those symptoms. They were asymptomatic, which means they have no idea that they're carrying that virus. We find them when we go into these targeted areas that we know we're coming into contact with other individuals, like nursing homes, which is one of the reasons that all states, including this one, have an unacceptable rate of infection and risk. How do they get that risk? Well, those workers who we thank every single day for showing up to work and caring for our loved ones have to go to the grocery store, have to put fuel in their vehicles, have to get their own medical care services, have to take their children to a child care center. All of those things are occurring. And when you don't wear a mask, you could have potentially increased, in fact, you did, increase the likelihood that they then get the virus. They have no symptoms. They then take the virus into these facilities, into these work environments. The only way we can do this until there's a vaccine, which could be 18 months, is if we double down on our commitment to do better. Lessen your travel, wear these masks, lead by example, protect our most vulnerable populations, and help us, because we've demonstrated, you've demonstrated, we can do this. In fact, we're all in it together in New Mexico. Let's keep demonstrating. Let's support New Mexico businesses by giving them every opportunity to open their doors and to serve us in a safe, reasonable manner by being as good as they are and showing up to these businesses as protected as we can be. So I really appreciate your paying attention to these messages. They are critical if we're going to get this right, and we're going to be able to maintain it over the long haul. So with that, I thank you for tuning in. I'm grateful for the work that you're doing. If you're already demonstrating this great behavior, thank you. Keep doing it. I'm sure it will encourage others to follow suit. All right, Nora, we are ready for questions.
Yes, ma'am. Okay, first we are going to go to Morgan Lee with the AP. Morgan, you are unmuted. Go ahead and ask your question.
Hi, thanks for this opportunity. Regarding the hazard pay for child care workers, are those workers able to do better financially by not working right now, given the kind of extra kick people are getting from the federal systems? Thank you.
Sure. Morgan, that's interesting that you asked that question. I asked that very same question right before the press conference of the folks who don't run child care services or lead any of those departments, because I am going to guess, and we'll get you the specifics, but I would estimate that a fair number of those child care workers are in fact at minimum wage. And as a result, and I would say many of them don't have adequate health care coverage. You might remember from an earlier press conference, we've made sure that all their COVID-19 risk would be covered and treatment. And we wanted to make sure that that was done through the New Mexico high risk pool. But I worry that in fact they would make more in unemployment. And part of this hazard pay is to make sure that they're recognized that if you're exposed to the general public, you're at a higher risk. They have families of their own. 2, it's to thank them for their dedication and vocation. And 3, it's to really set the stage. I hope the federal government will continue to invest in states like ours who recognize that we need to do this. And the last part, we should be doing better by our child care workers, and there should not be a situation where unemployment, which is intended to barely help you get by, not replace your whole salaries, that it ought to be better than that. Even with the federal, and we're grateful, additional $600 for unemployment benefits. So I'm going to guess that that's likely true for a great number. I can't say whether it's the majority or not, but we'll get you the specifics on that. And I really am grateful that you asked that question. I was concerned about that we need to be doing more. Thank you.
Thank you, Governor. Next, we're going to go to Jens Gould with the Santa Fe New Mexican. Jens, you're unmuted. Go ahead and ask your question.
Yes, hello. Thanks for the opportunity to ask a question. I have a question about the budget. Legislators are projecting around a $2 billion shortfall for the budget, which is larger than the amount that's in reserves. And the state also has the following fiscal year, 2022, to think about. I was curious if you, Governor, are considering at all trying to access the land grant permanent fund or any of the permanent funds to try to shore up the budget. Thank you.
Thank you for the question. And so I've been optimistic in our previous press conferences or news briefings related to COVID-19 that New Mexico, because we've been prudent about reserves and our permanent funds, we have several of those permanent funds for, in particular, with differing amounts, the largest being the land grant permanent fund. And this is my opinion, and it's one opinion, and it's going to take policymakers, that's the legislature, who are the appropriators, to really think about strategies that help us close that hole. I've seen estimates on the low end from $1.5 billion next year to the $2 billion number that you've identified. Both are extraordinary set of negative circumstances for the state, and we're still trying to figure out what we do and how much more stimulus money is going to come in. And we want a fair amount of that money to go for things that were never included in the budget, which would be things like a state PPP program, a paycheck protection program that gives a lift to small businesses and gets their employees back to work or maintains their ability to work. All right, long story without answering the question. I personally would favor one time or for 2 fiscal years running, utilizing not only our reserves and other set-aside funds, but the land grant permanent fund in particular. And it is my sense that those conversations are certainly being had by our appropriators and policymakers in the legislature. That's all of them. And that we are still aiming for mid-June for a special session. But while that fund is critical to the success of public education, the land grant permanent fund, and that dipping into it when the market and our investments are at risk and our large revenues are at risk, like in the energy sector, oil and gas, I am sure there's some trepidation about doing that. But if we're going to have economic recovery, and if we're going to signal to New Mexicans that the money we save, that they help us save, that is intended for their well-being, then I think we can make a legitimate case that that is an appropriate use in this extraordinary emergency. Thank God we haven't seen pandemics like this since the early 1900s. But we need to do everything we have in our power to make us as whole again, because it will take some time before we see economic recovery that stabilizes in a way that puts our budget back together in a meaningful format, or aspect for all New Mexicans. So I favor that. I think it's too early to tell New Mexicans that we have won that or that we've even provided it in a specific request, because it's early to policymakers. But I think it's an idea that has merit, and I expect it to be on the table for the special session. Next question.
Thank you, Governor. Next, we're going to go to Chris McKee with KRQE. Chris, you are unmuted. Go ahead and ask your question.
Thank you very much for the opportunity. I wanted to ask about the reopening, so to speak. It's clear that a lot of New Mexicans have their hopes up for sort of a limited fashion of reopening by May 15th or by mid-May, really. But we're already seeing places like City of Albuquerque, for example, has tentative reopening dates for things like summer programs. But meanwhile, during Dr. Scrace's presentation, saying based on the spread, we're not on target for a May 15th date. Also him giving that anecdote there about we're going to have a problem in central New Mexico based on the interactions he's seeing at just that store there. To the governor, are you prepared to extend the stay-at-home order past the 15th, and with that, potentially dealing with the backlash if you choose to keep that order in place?
So the short and quick answer is yes, I'm prepared for the continuation of individuals whose lives have been upended. I want to be really clear that I believe the vast majority of New Mexicans know that I take no pleasure in making tough decisions that restrict people's access to the business community, that support small businesses, and that allow people to move about freely in their communities. And probably it doesn't, and I hope that it does, though. I mean, I use these personal examples because they're true for every single New Mexican. I haven't held my grandchildren since the end of February. I see them through a car window or through the living room window in their front yard. I ask every day these same experts, when can I go in the house? And what do they tell me? You have to assume that you carry the virus and you can't carry it into the house. I ask every single day, when will it ever be safe for me to hold my mother's hand in her long-term care facility? When? And the answer is when there's a vaccine. And those are painful things for me to have to hear. I can only imagine how painful they are for people who've lost their businesses, who don't know when their lives get back to normal, who don't know how long unemployment lasts. It is terrifying to be in this pandemic. But I know that I cannot overwhelm the healthcare system, and I cannot allow for a new normal to assume that we're going to continue to have increased death rates in the state, particularly in areas that are high risk, like long-term care facilities, hospitals, corrections. So yes, I'm prepared to make the tough decisions. Here's what you didn't ask me. Do I believe that New Mexicans still have time to turn the corner? You bet I do. Do I believe that we can have what I've referred to as a, preparation phase, phase 1, phase 2, phase 3, and relax some of these restrictions and give us more access so that we're doing economic recovery? I do. Do I think that we can have both? I do, with some confining requirements and restrictions. Face coverings where appropriate, other protective, personal protective equipment like gowns and gloves, and that really reserved largely for folks who are doing testing and folks who are providing direct care and our healthcare workers and first responders. But wherever that makes sense, we should do it, and we're going to keep using that gating criteria. So I am still optimistic, but this data is critical, because it indicates that we're not doing as well as we could, and it means that we're not doing as well as we could. And my last plug, I have businesses that are working with every single department. We have local government councils, mayors, county commissioners. We have sovereign nations all working with us, and a recovery council that meets, frankly, every couple of days, who spend hours on their own and with me and state government looking at which strategies make the best sense for moving forward to opening up the economy so we can have both, not one or the other, not a false choice, both. And they remain dedicated, committed, and optimistic. So I've got my fingers crossed, but again, this really is up to New Mexicans, and I am hoping that we can all continue to improve those personal behaviors so that these numbers start to flatten out and then decrease. I think it's important to note also that there are a lot of states, I think, that are taking incredible risk, who have opened up their beaches only to close them a day later, who have opened up their parks only to close them a couple of days later, who have asked businesses to invest in incredible amounts of retraining and protective equipment only to restrict that further, who have incredible debates with mayors and local elected officials. I think New Mexico has demonstrated leadership in ways that most states haven't seen, because we're trying to do it all together. We're all on the same page. Even most of the communities in the Northwest region have come together to effect containment strategies to mitigate risk and spread. So, New Mexicans, I am hopeful.
You've been watching Governor Michelle Lujan Grisham's live press conference on the coronavirus, and I want to break down the big announcements she just made. The governor says she is prepared to extend our stay-at-home order if she needs to. Right now, it still stands until May 15th. Starting tomorrow, May 6th, employees at restaurants and retail essential businesses with buildings larger than 50,000 square feet need to wear face coverings on the job. And starting May 11th, that is next Monday, all essential businesses operating as a retail space will need to require employees to wear face coverings. The governor also says $12 million in grants will be provided for licensed child care providers who've been.
Thank you for that question. I mean, we have the ability to do more, and it is a huge component of successfully having information that allows people to make the best decisions about where we go next. So the military bases have been incredible partners, and I want to give them a shout out. So all three of our military bases, Cannon, Holloman, and Kirtland, have not only embraced, although I have no real power over them, they have embraced all of our public health orders and frankly even gone beyond them. And as an example, even the early part of March for our first orders, they limited their travel, which they don't really get to do. A general calls you to travel or to have certain staff be available anywhere in the country, you have to go. But they quarantined people when they returned, and they also really worked to eliminate anything that they have the power to eliminate in terms of unnecessary work-related travel. They've engaged in testing. I want to talk about that because that's really what I think is now the most important part. They've set standards and protocols for all of both their contractors and military personnel at all 3 bases. One base in particular set a standard that they would disallow any of their contractors or members, military personnel, from going to any essential businesses that on their own, prior to today's announcements, weren't wearing face coverings and utilizing other, metering, social distancing that met with the public health standards we had set. Because enforcement's been hard, although we're doing it and we'll do more of it. I really appreciate those bases. But what could they do? Well, the Department of Defense protocol for testing is only people who are symptomatic. Now we know that we're seeing a huge number in our state, and that's the experience all over the world, that there's a ton of individuals who are asymptomatic. So you have to expand your testing. They're only testing 1 or 2 people a day. They could quite literally set on a course to test every single military personnel and every contractor. They could do 20,000 tests in 2 weeks plus, but they have to have permission to do that from the Department of Defense. They're willing to do it. So I've requested that directly to the White House and the Secretary, and am hoping that they're going to get permission to expand their testing capacity. It would make a big difference for us to know what's going on in the state, and it will make everyone in New Mexico safer, and it allows us to get to that criteria in a more meaningful way. Yes, it is true that we have a facility in the southern part of the state that late last week had 3, I think, positive cases. I'll defer to the Secretary of Health, Secretary Kunkel, in 1 minute. We have tested, I believe we've completed all of the testing for every single employee. And while we wait for those results, because that finished up late yesterday, we have restricted the number of individuals that can work in the plant, and have further required that they have the highest level of personal protective equipment for those workers, given that's such a contained, high-risk area. And we know that there was individuals who were infected, who were likely in contact with those other workers before we got those positive test results in. So I think we've taken very aggressive actions, but we don't have all the details yet about how many positive cases. Do you want to say anything further about that, Secretary?
Thank you, Governor. And I believe we had 5 positive cases at that location. And I will say that we were successful in working with the company to come up with the plan where a very limited number of people continued in the plant. 100% have been tested. The plant will be clean to the expectations of the Department of Health, and we will have a reopening plan with them going forward so that the social distancing can be observed. And yes, they are in the highest level of PPE. Thank you.
Right. And this is why you have an expert with you, because I said 3 and the actual number is 5. So thank you for making sure that we're accurate. That's really important to this whole team, for every New Mexican who depends on us for valid information. Nora.
Thank you, Governor. Next, we're going to go to Selena Madrid from KFOX. Selena, you are unmuted. Go ahead and ask your question.
Hi there, Selena Madrid with KFOX 14 and CBS 4 out of Las Cruces, New Mexico. I had 2 questions for you. The first question I have is, Doña Ana County Commissioners approved a resolution last week which asks you to reopen the economy here in Doña Ana County. I was wondering what your response is to this for the Doña Ana County area.
So what we've been working to do is to tell all these local elected officials that their participation in looking at safe, economic recovery practices is not only welcome, it's expected, right? They have the expertise, they know who they have. I do worry a bit that some of these resolutions, that there's an expectation that the resolution enough suggests that if the community wants a reopening, that that's the same thing as having a community ready for complete reopening. And those two things are not always consistent. So we think it's valuable, important, and we want to respect the work of every community and county. But we also want it to be consistent with sound public health data about where we go. And this is another opportunity, this venue, to alert and to remind every community and every local elected official that we need you. We expect you to provide valuable, and it is, information about your intentions and your ability. Last thing about that, we also, and this is, we mentioned it a bit last week about the Recovery Council. You know, we do need communities to also affirm in their readiness that they will assist in enforcement, sound modeling of productive behaviors, a strategy if the numbers increase, what they will be willing to do, and that they've upheld the current public health orders. If they don't do that, they put the state at incredible risk, because we don't have the kind of resources to do all of that statewide. We need a real partnership. Vast majority of these communities are clear and interested about doing that. But we all have a responsibility, if you will, to have real skin in the game, to support local businesses who need our support to be successful, and by having the good social distancing efforts in place and modeled by locally elected leaders so that we know that we are mitigating spread. So long answer, but thank you to that community. Thank you to the Doña Ana commissioners, but it has to be consistent with the public health data, which is why we have public health data experts at every single one of these updates. Yes, Dr. Scrace.
Just a quick addition, Governor. Two other things about the Southwest. Number one is that it has the second fastest growth rate in the state after the Northwest. Second, and the biggest concern, is El Paso, and cases continue to grow in El Paso, and opening up commerce there is unfortunate in my opinion, but opening up commerce in Las Cruces would likely increase traffic back and forth between Texas and southern New Mexico and increase the rate of spread there. So I think every small community has its own unique characteristics, but I agree with the governor. We really need to move as a state wherever we possibly can.
Right. And one last thing. So the Economic Recovery Council efforts, you know, really is a statewide strategy. You know, we set the gating criteria, we provide the data about mitigation, we provide the recommendations through this council, we show them the public health data. They can give us recommendations based on their areas of expertise and the fact that they, you know, represent a variety of communities in the state. So we set that criteria and those expectations for the state. No one can go beyond that. But there are regions that absolutely we have to decide, or can decide on their own, to go lower than that, right? Move less quickly at reopening, which is one of the reasons for the Northwest region we've been really cautious, because while there's been some improvements, and I think part of that has been not only recent strategies, well, we'll continue to see data over the next several days, but that a real understanding that we've got high risk activity in the Northwest, and we've got to do everything in our power to mitigate. So we're not quite there yet, but I do appreciate the work of local communities in delivering plans and allowing us to discuss them and to take those recommendations into consideration through any number one of our economic recovery vehicles. Nora.
Thank you, Governor. Next, I'm going to go to Algernon DeMassa with the Las Cruces Sun News. Algernon, you're unmuted. Go ahead and ask your question.
Thank you, Governor and Secretaries. Today we're hearing about a requirement for mask wearing at restaurants and among retail workers. We have had an outbreak at a mine in Grant County. We appear to have some positive cases at a meatpacking facility. These are not retail businesses. And I'm wondering if the Health and Human Services Department or the DOH is proactively working with some of these more industrial kind of businesses where it's harder to maintain social distancing. If you're working with them on any best practices for keeping people apart and or requiring not just masks, but other PPE for workers as well. Thank you.
Thank you very much for the question. And the answer is yes. I want to say that we can do better in terms of all of it. A lot of these industries, oil and gas, the mine that you reference in Grant County, and certainly the setting best practices for food supply businesses has been something we've been really aggressive at. Does that mean that every single one of these businesses, and even though we put out guidelines, whether it's been through OSHA or the Department of Health and training, and we did, I think, frankly, an extraordinary job accessing PPE that can be made available to businesses and high-risk industries that needed our assistance, particularly early on when you could not get it. I know everyone, I expect that certainly the press, but that many New Mexicans have seen reports from other states where they're actually still having under guard their testing supplies and PPE supplies, because that gets interrupted depending upon where these deliveries to what airports are being made. And in fact, we often get reports by an effective and important federal partner, FEMA, but they take credit for everything that's come into New Mexico. Well, New Mexico and New Mexicans got this PPE in. We got very little from any other source, and that's true of every state. We've been out on our own. I think we've done an effective job. I think it could be better, and I'm going to defer now to the Secretary of Health. And I really appreciate the point that you're making. We should do better, I think, is your point. Maybe we can talk about some specifics.
Thank you, Governor. And I completely agree with the Governor that we could do better. At the initiation of the outbreaks, we did a lot of training, we did a lot of outreach, we did a lot of talking. We are now doing surveillance, but your point is well taken that we could revisit these hard to socially distance businesses and check in and offer more technical support. So thank you for that, and I'll report on it next week.
Right. And one thing before you go to Dr. Scrace is part of what the Recovery Council is doing is setting guidelines for all businesses, and really focused on all businesses, but particular attention to essential businesses. So the last meeting, which was yesterday, was all about what are those guidelines going to look like, and how do we make sure that they can be practiced and enforced. And again, that's yesterday, and we're moving forward. But we did set those expectations early on. We didn't require it while we kept messaging that you need to adhere to the social distancing requirements, or you're going to have an outbreak. And if you have an outbreak, then you'll have to shut down or limit those essential service activities. Dr. Scrace.
Yeah, two very quick things. The medical advisory team is also working hard on this as well in the areas of office workers, retail, food, and to your question, manufacturing. We've got infectious disease, infection control, public health, and occupational health experts finalizing those specific recommendations today. The other point is that literature comes out every day. We read lots of articles every day. On May 1st, an article came out on infectious disease modeling, and I'll just tell you the conclusion as it applies to New Mexico. If 80% of New Mexicans wore a face covering that was only 50% effective, we would save 1,789 lives in this state. And I know the key here is to think about one of those 1,789 lives being someone in your family, not strangers. And so each of us has a part we can do every day to save people's lives here in New Mexico by wearing a face covering. Thank you.
Perfect. And I know that we're going to take another question, Nora, but some of these recommendations, to your point, are also going to be about plexiglass shields between, I'll use the obvious, someone working a cash register and consumers. but manufacturing separation is going to be part of those recommendations. And again, we can do better, we will do better, but a lot of this data is just now coming to bear so that you've got industry-specific standards so that you know that they're enforceable and meaningful both. We want both in this context, and that information is now more readily available, and we're utilizing it. Nora.
Thank you, Governor. Next, we're going to go to Matt Grubbs with New Mexico PBS. Matt, you are unmuted. Go ahead and ask your question.
Thanks very much. I know there's a significant amount of effort that goes into these, and I appreciate them. Governor and secretaries, given the numbers just cited by Dr. Scrace, I'm wondering why you're reluctant to mandate masks or face coverings for everyone, and what states, such as Illinois, Massachusetts, or cities like Denver, San Francisco, are you looking at to see if that works and if it's feasible?
Well, thank you for that question. So I think that I know I can get a public health order drafted. I want you to know that my general counsel is holding his breath right now while I say this, that mandates that every single New Mexican is going to wear a face covering. Now, whether or not the challenges that will come, that I win that, is still a little unknown as you look at what's occurring across the country. The bigger issue is this. Is enforcing that mandate. And the jurisdictions that you've just identified and meeting with those governors and talking with them, including Georgia's governor, Governor Kemp, Illinois' governor, Governor Pritzker, Florida's governor, DeSantis, they are really struggling in how do you enforce that? And then we create even more difficulties in terms of changing behaviors. And as I'm looking at that sort of rate of return, I'm unconvinced that mandating it will get us the results that we need. However, you draw a really important point, I hope, by virtue of this question, and it gives me an opportunity to maybe do this one more time. When we get data that suggests, and I'll give an example. When I was the Secretary of Health, 2004 to 2007 in New Mexico, we learned that there was an incredible risk after we didn't require by law having children who had outgrown their infant carrier seats, which was the law. We didn't have a booster seat requirement. And many states were looking at their public health and their data about childhood safety and the amount of horrific injuries and death related to car accidents where a child was unsafely restrained because they had outgrown car seat. So New Mexico wanted to join using that data to increase the amount of time it takes in a car seat or a booster seat. That was a very hard piece of legislation when I was a secretary to get passed. People didn't want seat belts and car seats and booster seats and requirements about smoking. Laws that affect human behavior are incredibly complicated, and it takes a while to make them effective. And that's a sad thing, I think, about general human behavior. So given those examples, if that's the only way to save lives, then every state, including this one, should look at that as a potential strategy. Today, the benefits of asking, encouraging, making available, and showing that we're going to require businesses to do that, and if you want them to stay open, we have to stop the spread, you have to wear a mask, we think is easier to enforce, better to role model, and more effective. But Matt, let's see how this goes as we work for the next 12 to 18 months to manage COVID-19 in this state and in the country. But I think that we have to keep saying all ideas that make a difference, that save lives, have to continue to be on the table. But so far, I don't see that mandating gives us the impact that we really want. It hasn't seemed to quite work. Start, stop is what I'm seeing around other cities and states.
Thank you, Governor. This will be our last question, going to Ed Williams with Searchlight New Mexico. Ed, you're unmuted. Go ahead and ask your question.
Thank you, Governor. Just in terms of N95 masks, has the state been able to acquire an adequate number of those N95 masks yet? And can you tell us where within the state and local governments have those masks been sent so far?
All right, so I'm going to have to ask, he's doing it already, Dr. Scrace to sort of pull up, or someone to pull up our PPE list. I don't have it right in front of me, and I should have that every time we have a briefing, so thank you for raising it. We are confident, again, if we continue to manage the number of hospitalizations, which isn't the only place we have PPE, but is a significant place that you have to have PPE, that with the number we've received in, and I'm going to look for the total that we have available to us, that's coming up, and the number that we've distributed, that we are in good shape. If that shifts, then we would be at a disadvantage. So let me tell you how many, and the N95s for viewers again, these are masks that we refer to as a respirator mask. It is of the kind of medical grade that we know that transmitting or getting the virus, that you're completely protected. And they fit, they're personally fitted, they fit tight enough. You've seen photos of healthcare workers and first responders who wear them all day, and they literally make an indentation in your skin because they have to be that tight in order to have the right effectiveness. Dr. Scrace, did you find that?
No, I don't have that on my computer, but I'm
all right.
I do have a
General?
point around the N95 masks that is pertinent to this discussion, and that is there is a unit that New Mexico acquired. We acquired one of 60. It's known as the Battelle Decon unit. It is currently set up at the Santa Ana Star. And this decon unit can clean 85,000 masks a day. And so while the N95 mask was a very high concern for us early on, it is less of a concern at this point. There are 25 entities that have subscribed to send their PPE into this Battelle unit to get cleaned on a regular basis. They're using FedEx and UPS as a method of shipping their PPE to the Battelle unit. It is in operation today, and I don't believe that N95 masks are going to be a concern for New Mexico, ma'am.
But one thing we should do to your question is we can provide to you as part of your question everywhere we've sent them. So counties have received them, first responders have received them, food workers who are preparing food for seniors and children have received them, long-term care facilities have received them, home health care workers, hospice workers have received them, our sovereign nations have received them, Navajo Nation just received a shipment. So we've really worked hard to make sure that we reserve enough so that as we see, and of course we're trying not to see that, an increase in what's available to hospitals and healthcare workers, that we're distributing appropriate PPE where it needs to go, and we'll give you that distribution list and give you examples of what we have available so that you have those specifics to you. And while we still have an order supply mechanism coming in, we do have a higher degree of confidence that we are in good shape, and that we expect to stay in good shape. And maybe one last plug, if there's a community that feels like they aren't getting what they need, please contact us and we can provide a delivery of the right PPE. That's frankly to the good work of the state. You know, we got aggressive about getting these supplies in early because clear to me and clear to the experts, when you had a nation that was not looking at a national strategy, we knew early in February, early January, when we ran our tabletop exercises, that if you didn't get in the queue and find ways to get it made, delivered, identified, and procured, you were not going to have enough PPE for your citizens and for your essential workers. And so we did that early, and it definitely paid off. Now for a lot of these folks, including hospitals and healthcare workers, it's easier to access, but they are still far too expensive. And we are now actively engaged with the Guard and the Attorney General. Shout out to the Attorney General that we are really working diligently to identify fraud and to support the nation in beating back black market in inappropriate efforts to gouge states, hospitals, healthcare workers, and even individuals. So that's another thing that we don't really report about, but it is something that we're actively engaged in. So I appreciate that. I know these are long, but they're so important, and I hope they're valuable to you. They are valuable to me. I get a sense about what folks are interested in, what questions still need to be answered. This team communicates and meets constantly about what's happening. What is the data? What do we know? What can we do differently? Every single day is a revised strategy based on science, based on fact. And there's no question that we have hard lessons that we learn about what we could do differently, and we accept those and accept those challenges. I'm tough on my expectations for state government. I expect them to make a difference, to save lives, to do everything in their power. And quite frankly, I expect those high standards from every single New Mexican. And I just want to go back to where we started and then end it. I don't want people to feel like we're not hopeful. I don't want anyone who's viewing this to assume that the May 15th effort was sort of an arbitrary beginning of the summer, got to make decisions, and we do, and those are forthcoming, about children's youth programs and summer camps. But again, how many people are going to come into contact? How close is that contact? Can you do anything to separate out people? We look at those strategies for every single decision. And when the risk outweighs the benefit, and I'm going to give you an example, and then I'm going to end. I know that there is incredible frustration by community members and by New Mexicans about any number of state parks, particularly, we have a pretty short lake season if you're a boater. My fiance is a fisherman. I'm a fisherwoman and boater. And look forward to those seasons at New Mexico lakes every single year. But even though it feels like if you're on the lake, you're not in contact, I just want to point out that some of these lakes take up to 20,000 visitors a day on a weekend. And 20,000 people in a small community who are getting gas, who are going to the marina, who are talking to park rangers, who are paying parking fees, who are having their boats inspected before they can be launched at the marina or off the dock, who get supplies, who go into the marina or go into the vendors, who go to the grocery stores, who get ice. They bring the virus in, they take the virus away. And I think about communities. I think actually about truth or consequences in making these decisions. I think about the veterans' home. I think about every single veteran who is at risk every time we stretch, and we should be, and trying to make these tough decisions. Every single one of those veterans deserve leadership in a state that is clear about their risk and clear and single-minded about protecting them and every other high-risk population. It's like threading a tiny needle with a giant cable. I think it can be done, but it isn't without really understanding what the risks are. So be hopeful, be mindful, help us make a difference, keep trending in the right direction, and remember to give thanks for the folks, particularly in the Northwest region, who have made really tough decisions, who are working together as one unit, who have demonstrated to the United States and quite frankly the whole world that when you do it together and you make tough decisions together, like Gallup, that you can really mitigate spread, save lives, protect one another, but we did it as a collective. It wasn't an individual effort. I want to thank them for their incredible leadership. want to thank the mayor and every single legislative leader and every single person living in that community and the Navajo Nation, Zuni tribe, Acoma tribe, and Laguna tribe as examples of incredible dedicated leadership, all aimed at saving lives. Thank you. And thank you for tuning in. I appreciate it.